During the time of this global pandemic and civil unrest, walkability is so important. While we have been socially distant and sheltering in place, walking and enjoying our public spaces such as parks and greenways have been some of the few activities that we have been able to enjoy. However, as more people are out in public spaces, it raises awareness about the lack of properly maintained sidewalks and safe infrastructure to do so.
The Virginia Walkability Action Institute is an initiative by the Virginia Department of Health in collaboration with the Centers for Disease Control and Prevention to train and support municipal staff in improving walkability in their cities, towns, and neighborhoods across the Commonwealth of Virginia. What is walkability? It is a measure of comfort, safety, and accessibility for pedestrians to enjoy walking around in the built environment. If you've ever taken a walk or rolled through downtown, through your neighborhood, to school, or to the park, you've been a pedestrian who has experienced walkability. And here's what we know about being a pedestrian and walking. Walking provides us with a form of physical activity and exercise. It is good for our physical health, and a majority of us can participate, even those of us with physical impairments. Walking outside improves our mental, emotional, and social health, which leads to an overall improvement in our well-being. According to the Centers for Disease Control and Prevention, or CDC, in the state of Virginia, 78.8% of adults reported participating in physical activity in the past month during 2018, and only 22.4% of students between 9th and 12th grade in Virginia reported to be physically active on a daily basis in 2017. Many of us Virginians face chronic health issues that have been shown to be linked to a lack of physical activity in addition to stress. According to the CDC, 30.3% are considered to experience high blood pressure or hypertension, 29.9% are considered obese, and 9.5% are considered to have diabetes. Walking is the simplest form of physical activity, and it seems intuitive that we use this to our advantage to improve our health and well-being. The goal of the Virginia Walkability Action Institute is to increase access to physical activity through walking and walkability. Most of us live in hostile walking environments with no sidewalks, no shade, no separation from vehicular traffic, no lighting, and no connection to destinations. Our cities and towns are not always the most encouraging places to walk, and they often have low walkability outside of dedicated outdoor recreational areas or dense urban downtowns. According to the National Highway Traffic Safety Administration, in 2018, the state of Virginia ranked 31st for pedestrian fatality rates, where pedestrian fatalities represented 14.4% of all traffic-related deaths in the state. We also know that pedestrian deaths in Virginia occur more than twice as often to black pedestrians at a rate of 2.1 times per 100,000 people compared to white pedestrians who experience a pedestrian fatality rate of 1.41 times per 100,000 people. Not only do these hostile environments impact our physical health and livelihoods, the lack of walkability in our cities and towns has other implications for those of us who need or choose to walk as a primary mode of transportation to work, our schools, the grocery stores, parks, neighborhood retail, and other community services. In Virginia, according to the American Community Survey 2018 5-year estimates, 6.2% of households do not have a vehicle available, and 2.4% of Virginians are reported to walk to work.
The senseless killings of Ahmaud Arbery, George Floyd, and countless others are examples of why the VWAI is so important during this time. Virginia Walkability Action Institute is not afraid to talk about these tough issues like racism, systemic racism, and discrimination that have led to these tragedies, and how our communities have been shaped by them. We must acknowledge that walking, moving, occupying our cities and towns, our neighborhoods, public spaces, and streets without death or fear of death is a basic human right. We should not accept anything less and want to take the necessary actions to avoid them.
It is crucial to remember that proximity does not equal access, and accessibility is one of the key components of walkability. Walkability not only refers to the conditions of a walking environment, but also the connectivity and comfortability of where we walk. According to the CDC, in 2010, 31% of people in Virginia lived within a half mile to a park, and 64% of the kids between 5 and 9 years old live within half a mile of a public elementary school. Yet, when we consider walkability and seek to improve walking and walkability in our communities, we need to question the quality of the walking trip, including the potential environmental and traffic safety conditions that pedestrians face. Walkability stands at the intersection of public health, planning, and transportation. Thus, improving walkability in cities, towns, and neighborhoods requires collaborative solutions and action across a variety of public professions.
Human beings need peace, shelter, food, income, education, a stable environment, and sensible resources to be healthy. Transportation is a network. Service is an infrastructure necessary to provide community residents with the means to get from one place to another. It is vital to assessing goods, services, including health and social services, our social networks, housing, education, employment, and much more. And these are paramount to creating safe, healthy, and connected communities.
The Virginia Walkability Action Institute works with local and regional interdisciplinary teams of municipal staff to create policy, system, and environmental changes for local communities.
The interdisciplinary representation in the Virginia Walkability Action Institute is important because the issues of health equity and transportation do not reside in one discipline. This is a complex issue that requires complex solutions. Providing a platform to bring together the learned and lived experiences of others is needed to begin to chip away at them and to create healthier and more active residents.
In 2019, the Virginia Department of Health hosted its first cohort of the Virginia Walkability Action Institute. Our 2019 teams represented cities and regions from across the state, including Central Shenandoah, Chesapeake, Eastern Shore, Hampton, and the city of Richmond. And our most recent cohort in 2020 represented teams from Central Shenandoah, Central Virginia area, Fairfax County, Portsmouth, and Prince William. Altogether, our teams have comprised of professionals from public health to parks and recreation to public works.
It's been really wonderful to work, especially with the health department and with Augusta Health. In previous meetings that I go to with my work, I feel like I'm generally surrounded by other planners or engineers. And so to deal more with the health aspects of planning even was helpful for me because I'm generally more focused on the transportation aspects of planning or the historical aspects of planning, etc. And so I really appreciate the including health, and I hope that moving forward I will continue to include them in the conversations that I have because they have expertise that I certainly don't.
We have 500 and some miles of missing and broken sidewalks, and it was always a challenge. What can we do? And I was intimidated because this was something new to me. I thought I knew some things, but I really didn't. But now I know what we need to do. I learned about the grants. So the intimidation level has gone down. Now I'm ready to fight.
All teams developed a detailed action plan to pursue a policy, system, or environmental change to improve walkability in their community. Teams received training and technical assistance throughout the program to guide the development of their action plans, both virtually and in person. As a participant, you get to customize the curriculum to learn about how you want to see walkability improve in your town, city, or neighborhood. Then teams developed ideas and are provided with financial and technical support to implement a small-scale strategic action to improve walkability in their community. In addition, our teams from across the state joined together for a multi-day in-person facilitated training to build rapport, learn together, and collaborate on strategies for improving walkability in their respective communities. Throughout the remainder of the term, teams met virtually for learning modules taught by nationally and internationally renowned experts, as well as for office hours to receive dedicated technical assistance on their action plans. Right from the start, you get to choose where to apply the special project funding to kickstart walkability improvements. Yep, you heard that right, special project funding.
In late summer, early fall, the Virginia Department of Health releases a competitive application for local health departments to apply for the Virginia Walkability Action Institute. The application consists of the identification of team members, past experience in population health focused initiatives such as community health assessment or community health improvement plan, and responses to questions about how the Virginia Walkability Action Institute will complement or enhance the work they're doing in their areas. While the applications are through the local health departments, anyone interested in learning more or participating can visit the VDH Healthy Communities webpage.
When we build and design cities for the most vulnerable of transportation modes, then our built environments are at their most accessible, safe, and enjoyable. The Virginia Walkability Action Institute sets out to help and support municipalities across the Commonwealth kickstart their walkability improvements. If you're convinced that improving walkability is crucial to the well-being of all Virginians, then we encourage you to reach out to us and apply to the Virginia Walkability Action Institute.